Good morning, everyone, and thank you for attending today. My name is Erin. I'm a proud registered nurse and the provincial president of the Ontario Nurses Association. We represent more than 68,000 nurses and healthcare professionals and 18,000 nursing student affiliates who work tirelessly in every health sector across our province. We are here today with a simple message. We are demanding that our next Ontario Premier and our hospital CEOs, whose mandate should be to ensure that our patients receive safe, quality care, have a heart and implement nurse-to-patient ratios. The hospitals where 60,000 ONA members work are in chaos and consistently over capacity, some as high as 120%. Our patients in our emergency departments are being treated in makeshift areas because there are not enough nurses or staff to take care of them. Having run on a vow to end hallway healthcare, Doug Ford has done anything but. Hallway medicine has become the norm, with patients waiting hours upon hours in emergency departments and sometimes days. Others have to drive for hours to even get to an emergency department because so many hospitals in smaller communities are cutting hours and closing doors, all because there are not enough nurses. Last month, ONA was in provincial bargaining with the Ontario Hospital Association to negotiate a new contract. And to say that it was categorically unsuccessful is an understatement. We proposed concrete solutions to improve hospitals for our patients, but the OHA on behalf of hospital CEOs was not interested. Instead, they tossed dangerous concessions at us. And ONA brought solutions to the table. Implement registered nurse-to-patient ratios in hospitals. Overwhelming evidence shows nursing ratios will fix understaffing and make it easier for Ontarians to get the best hospital care as quickly as possible. We've seen nursing ratios implemented in California and British Columbia with much success. And what has become clear is that hospital CEOs and the Ford Conservatives are not interested in real solutions. They're working hard and working hand in hand to gut our public hospitals and our healthcare and sell it to the highest bidder. They're in it for their rich friends, not us, not you. Doug Ford, who called a $180 million unnecessary election, has withheld billions from our healthcare every year. Those funds, and this is shameful, could have meant more frontline nursing care. It could have meant lower wait times. It could have kept the doors open at your local emerge. It could have saved lives. Instead, Ford decided again and again to keep our healthcare dollars in his coffers and hand it over to expand private for-profit clinics, saying it will solve the problem, a problem he created. Last fall, a bill was introduced at Queen's Park to implement nursing ratios, but Mr. Ford and his Conservatives defeated it. Nursing ratios could have made a real difference for hospitals, for patients, and for frontline nurses. But the Ford Conservatives are simply not interested in staffing in our public hospitals. This election has brought the opportunity for Ontarians to demand better. While nurses fight for public health care at the bargaining table, all of us can fight for it at the ballot box. We need a government that will actually improve our public health care, not hurt it more. Across the province today, nurses, like those standing with me here, are delivering Valentine's messages to their hospital CEOs, asking them to care about patient care about those who deliver it, and to have a heart. Nurses and healthcare professionals deserve better. Ontarians deserve better. Let's all demand better now. So we have some guests here today and some registered nurses. And next I'd like to turn it over to Liz Romano, who is a registered nurse. Liz.
Good morning, everyone. The hearts you see around you will be presented this week to our CEOs. The hearts represent the thousands of nurses at my hospital who could not be here today because they're at the bedside caring for our loved ones. Although they are not here, their voices are ringing loud and clear. We need safe nurse-patient ratios. I can tell you that these same nurses signed these hearts because they are deeply concerned about their patients' lives. We chose Valentine's Week deliberately to bring our message to our hospital CEO. While we give our hearts to patients 24/7, we're seeing our ability to provide safe patient care compromised. To my CEO and to all the public hospital CEOs, we keep hearing about budget constraints, but budget reflects priorities. When management is bloated, while frontline care is stretched thin, that's not a budget problem, that's a priority problem. We need guaranteed RN patient ratios. Why aren't CEOs speaking up for the nursing ratios and speaking out against privatization for our public hospitals? Since 1993, we've seen cataract and orthopedic surgeries taken to private clinics. Since these clinics charge more than OHIP rates, burden patients with extra costs to enrich corporate interests while draining resources, funding, and nursings from public care. This directly impacts staffing levels in public hospital. It means less nurses to provide patients with the care they need and deserve. Public hospital CEOs, your legacy is being written now. Will you be remembered as someone who protected public hospital health care, or someone who stood silently by supporting the Ford's Conservatives' privatization agenda? The hearts we present today could be a symbol of hope, that you'll join us to improve public hospital health care for all Ontarians, not just those who can afford to pay. Our question remains, why aren't you saying no to privatization and yes to nursing ratios and bargaining? Mm-hmm. Our patients deserve an answer. Yeah. Maureen.
Thank you, Liz. Every day we face impossible situations in our public hospitals. On acute surgical units, we are caring for patients who have undergone complex procedures. These patients often have multiple conditions putting their lives at risk. Nurses are often assigned 4-to-1 or 5-to-1 patients on days and more on nights. Imagine having 1 hour to provide care to 4 complex patients with multiple conditions. You must somehow divide that 1 hour between administering medications, dressing changes, reposition patients to prevent bed sores, and monitoring vital signs. It's like being asked to be in 4 places, knowing that minutes can make the difference between life and death. The ethical dilemma we face is heartbreaking. Imagine nurses that are already busy with their assigned patients and 2 patient call bells ring simultaneously, both potential emergencies. Who do I give care to first? This is not about prioritizing tasks. It's about having to decide whose life takes precedent over the other. I've watched colleagues leave the profession overwhelmed by the emotional toll of providing less care they know their patients needs. Our hospital CEOs have consistently understaffed our public hospitals while expecting us to provide high-quality nursing care to every patient 100% of the time. The solution is clear. We need mandated registered nurse-to-patient ratios. These aren't arbitrary numbers. They are based on the level of care patients require. Without these ratios, we will continue to see increased complications, long hospital stays, delayed healing, and missed opportunities for early interventions. Today, our message to our CEO is simple. Have a heart. Protect and improve public health care by agreeing to registered nurse-to-patient ratios. These ratios aren't just numbers. They represent our abilities to provide safe, quality care that every patient deserves. Thank you.
Thank you, Maureen. And next, we have the President of the Ontario Federation of Labor, Laura Walton.
Thank you, Erin, and thank you to the nurses who are using their voice today to call attention to a problem. I stand here today on behalf of 54 unions and over 1 million workers in complete solidarity with our siblings at ONA, and we lift up the call to hospital CEOs and to the next Ontario Premier. Safe, quality care is a must, and it begins with ensuring registered nurses to patient ratios. After 7 years of Doug Ford and his government, our nurses who are integral to our healthcare system have gone ignored. We see announcement after announcement about building hospitals, but Ford ignores the fundamental truth. You can build all the hospitals you want, but if you fail to fund them operationally, if you have failed to ensure proper nursing ratios, all you have is a building. Healthcare requires staff to provide the care. Over the past few weekends, we've been knocking on doors. I'm just back from Sudbury and Thunder Bay, and what we heard was clear. Healthcare is the #1 concern for people in this province. Families are terrified about hospital closures. Seniors are waiting longer for care, and nurses are telling us they are drowning under impossible workloads. And what's Ford doing? Well, he's wasting $180 million on a snap election and handing out $3 billion in pre-election checks. Money that could have gone directly into fixing our healthcare system and ensuring these ratios. I want to be clear, though. Doug Ford is not failing by accident. This is a choice. He is starving public health care so that he can hand it over to private corporations. This is a deliberate strategy to manufacture a crisis and justify privatization. We won't let them. Last week, I met with the Prime Minister, industry and labor leaders at the Canadian Economic Summit. Mr. Trudeau spoke about the Canadian advantage, the Ontario advantage, our public service system. That ensures that workers are the very best. Workers in Ontario go to work knowing that there is publicly funded, publicly delivered education for their children and publicly funded, publicly delivered health care should they or their families become ill or injured. It's why I simply refuse to believe that Ford understands what he's doing by continuing down the path of privatization. He says there's no money to fix health care. The money is there. He just refuses to spend it on people who need it. His priority is privatization, letting hospital CEOs push services into private for-profit clinics while our public system collapses. It's why today we stand with nurses in Ontario who are delivering these Valentine's messages to their hospital CEOs. Nurses know what is needed to fix this crisis. Safe nurses to patient ratio. And I want to send a message to every healthcare worker in this province. This fight is our collective fight, together. If you are a nurse, a doctor, or a healthcare worker, you deserve better. If you're exhausted, overworked, and ready to leave the profession, know that we are fighting alongside you every step of the way. We see you. To every worker who relies on publicly funded, publicly delivered healthcare, this fight is our fight. If you've ever sat in an overcrowded ER, waited months for a surgery, or worried about your loved one getting care, know that Ford's decisions are making it worse. And together, we will make a difference. At the ballot box, Ontario needs to make their voices heard. Ford has had $3 billion for pre-election checks, but nothing for nurses. He had $180 million for an election, but not for patient care. He is manufacturing this crisis to justify privatization, and we and everyone I'm here with and those at home are not going to allow it. I'm calling on every Ontarian. It's time to fight back. It's time to demand safe staffing ratios, demand an end to privatization, demand a real investment in healthcare, because frankly, our lives depend on it. Thank you.
And it's my pleasure to introduce Marit Stiles, the leader of the Ontario NDP, who is, thank you for being here with ONA members today and nurses. Thank you.
Thank you. Thank you so much. Good morning, folks. I'm Marit Stiles. I'm running to be your premier. I want to thank Erin and Laura and all of the registered nurses who are here with us today. I want to thank Erin and Laura and everyone who has stood by Ontario healthcare workers through 7 long and very difficult years of Doug Ford. Look, in Ontario, we value nurses, your hard work, your skills, the care you provide. We know our healthcare system depends on you. And when the worst of the pandemic hit, it was nurses who bravely put in 20-hour days to take care of people. When our loved ones are sick, it's nurses who stay by their side. But thanks to Doug Ford's disrespect for all frontline healthcare workers, we are seeing more and more nurses burn out and leave the work that they love. Instead of respecting nurses and healthcare workers, Doug Ford froze their wages and took them to court. He called them healthcare heroes while taking away their pay. This is just more proof that Ford cannot be trusted. Enough is enough. We need to rebuild the capacity of our healthcare system, and it starts with hiring more nurses and establishing safe staffing ratios to make sure that patients get the care they need when and where they need it. As Premier, this is exactly what I will do, because without nurses, there is no health care. Let's be really clear here. The Liberals, before this, did start the fire in our healthcare system, but Doug Ford poured gasoline all over it. Hospitals across Ontario are facing extreme pressure, with many emergency rooms having to close their doors. Patients are being treated in hallways because of a severe shortage of nurses. Ontarians know this. We know that this is not the fault of nurses. You know that, I know that. Doug Ford has had his chance to fix things, and he didn't. But guess what? We are going to fix it. In British Columbia, the NDP government brought in nurse-to-patient ratios, and it's working. We've been calling for this change in Ontario for years now, and Doug Ford voted against it over and over again. He voted against nurse-to-patient ratios. He voted against fixing our healthcare system. What did he vote for? Private, for-profit healthcare companies that make a profit and do it on the backs of patients. Hospital budget cuts, freezing nurses' wages. He is not the guy for this job, and maybe that's why he quit. And let me tell you, like so many of the folks who are here today who work in the healthcare system, but I myself, like so many of you, the last 2 years, both of my parents ended up in hospital for various reasons at various points, and I've spent many hours in emergency rooms with my daughter, with my parents, listening to healthcare workers. They talk a lot, registered nurses talk a lot about the moral distress that they feel at not being able to provide the care that they are trained to provide and that they want to provide to their patients. You've heard about the burnout that they're experiencing. I've I've seen that firsthand. I've heard that directly from nurses in the emergency rooms, caring for my parents when they needed it most. We owe it to nurses. We owe it to our healthcare system, and we owe it to all Ontarians to fix this. What we need, what Ontario needs, is a premier that is on your side with a plan to fix this crisis. I will make sure that healthcare workers get the respect they deserve with a fair wage and safe working condition. And I'm going to bring in nurse-to-patient ratios to stop burnout and deliver better care for people. As Premier, I'll make sure that you get the healthcare you need, where you need it, and when you need it, because I'm on your side. And I think with that, we're happy to take questions.
All right. For those on the line, please press star 1 to get the question line up. Good morning, Émilie Boujon-Pelletier with Le Droit. My question is actually for Erin. Just to be clear, is this an ONA endorsement for the NDP?
ONA is constitutionally nonpartisan. What we're here today to show is that there has been a commitment by the NDP to nurses and to healthcare professionals. We saw that with the drafting of the nurse-to-patient ratio bill. And we're happy to have the NDP with us today to emphasize their commitment.
And I understand, I mean, you've made it pretty clear why you wouldn't be endorsing Doug Ford's PCs, but why not choose the Liberals, for example, to support, which has been centering healthcare and patients and healthcare workers throughout their whole campaign?
I'd be happy to speak to the Liberals if they were looking to table a bill to promote this.
Hello, can I move this thing? Sorry, I just might need a nurse myself. Mart, in terms of ending the reliance on private for-profit nursing agencies, I understand that some nurses quite like working for these agencies because they can achieve better work-life balance, flexibility, and much higher pay in some cases. So I'm just wondering if you can elaborate a bit on how exactly your party would reduce reliance on these agencies without negatively impacting the workforce itself.
Yeah, absolutely. Well, I mean, and this is one of the reasons why nurse-patient ratios are so critical to this conversation about how we fix our healthcare system going forward and how we stop the burnout and also, frankly, the bleeding, the hemorrhaging of healthcare dollars into these for-profit private agencies that I will say also have a lot of connections, insider connections to the Ford Conservative government. So first of all, nursing agencies, private nursing agencies are costing people of Ontario hundreds of millions of dollars a year. The way we get back to where we need to be is we bring in nurse-patient ratios, but we also use that hundreds of millions of dollars to hire more nurses, to take the pressure off of individual nurses. We give them in that situation then more choice, more flexibility. We ensure that they're being paid decently. We respect them. Here's another thing. We don't take them to court to suppress their wages. You know, let's start there. But I think it's really, those are the key components, right? We've seen this happening because, yes, it is hard to be a nurse and a registered nurse in the province of Ontario right now in our hospitals. So let's make sure that we redirect those hundreds of millions of dollars into making the working conditions of nurses in our public hospitals and our public healthcare system safer and better.
All right, and Ontario Health data shows that since 2020 and up until at least August of last year, that at least 10% of patients with highly aggressive cancers waited more than double the province's recommended time for surgery. So you've promised to create a centralized waitlist for specialist treatment, but what more would you do to cut surgical waitlists?
Yeah, so we'll be talking more about some of the details of that plan as we go forward. But absolutely, I mean, that's a key component of that is a central referral system, right? So we've already talked about addressing the physician shortage, the family doctor shortage, building and investing in our health teams. We're talking about a central referring system. We're talking now about nurse-patient ratios. These are all critical components to getting Ontario back on track, to making sure people get the care that they need when and where they need it.
Thanks. Jordan with the Canadian Press.
Hi.
I'm wondering if you could answer, Ontario is already tens of thousands of nurses short. How many more do you think we'll need to meet these ratios that are being put forward today? And where will they come from?
Well, I can tell you, first of all, what our commitment will amount to. And again, I just want to reinforce our currently what we are seeing is nurses are leaving because of burnout, because of that lack of respect by this government, and you heard it. I mean, the hospital CEOs as well, right? So bringing in staff to patient ratios or nurse to patient ratios is a critical component to restoring better life balance, better conditions to ensure that patients are treated properly, that nurses don't burn out, and that they have safe working conditions. If you look at our plan, our initial commitment is 15,000 nurses over 3 years at a cost of about $1.5 billion over that 3-year period.